The date is March 12. This is the news on PBCJ. I'm Simone Absalom Gale. Several thousand Jamaicans were inoculated on Wednesday, March 10. Speaking at the weekly COVID-19 conversation press brief on Thursday, Health Minister Dr. Christopher Tufton gave an update on the day one of rollout.
We had 39 vaccination sites across the island. Our original target, and I know we have said a few different numbers over the last day or half a day, because the numbers took a little while to come in, and we crave your indulgence and your understanding if you heard 29 6 hours ago and you're now hearing 39. So we had 39 sites. 33 were originally planned, but for whatever reason the regions adjusted. So we actually exceeded the number of sites that we had originally planned. The goal was to inoculate approximately 3,280 members of the priority group, which were, of course, healthcare workers primarily. We started at 8 a.m., ended in some instances at 10 p.m., and at the close of the day's operations, we were 2,718, or 83% of the target population for day one.
Dr. Tufton said the plan is to vaccinate 17,000 persons over the next week.
Our aim in the next 7 days is to inoculate some 17,000 persons over the next 7 days. So we're targeting 17,000, continuing with our priority groups, healthcare workers first, and depending on how far we get in that group, then we move to the uniform officers of the constabulary and the JDF, which has already started.
Public health nurse Marcia Thomas Yetman created history when she became the first person on the island to receive the AstraZeneca COVID-19 vaccine. She spoke of her experience at the virtual press brief.
How you feel 37 hours after getting the vaccine?
I'm feeling fine. I'm not having any experience out of the ordinary. As would be expected, there's a little tenderness at the site and a little tenderness in the axilla on where the arm was vaccinated. And that basically is it. A little tired now and again, I'm not sure. Those are expected experiences persons would have, and we were told that we would have had those.
So you went to work. You went to work today?
Yes, Mr. Minister, I went back to work after I got the vaccine yesterday.
What?
And I went to work today.
I don't want you to get... Go ahead, sorry.
I was just saying to someone that the rain wet me yesterday. People always say when you get wet by the rain, when you have injection, all sorts of things would happen to you. And I got wet by the rain and I'm fine, no fever. I'm doing well.
Up to Thursday, March 11, the island's COVID-19 death toll was 475 and climbing. Typically, the most at-risk groups include seniors and persons living with comorbidities. Comorbidities refer to the simultaneous presence of two or more diseases or medical conditions in a patient. Examples include diabetes, hypertension, or renal failure. However, to date, not all persons who have died from the virus were seniors or even had comorbidities. This was a point highlighted by Chief Epidemiologist Dr. Karen Webster-Carr at Thursday's press brief.
When we look at the comorbidities and risk factors for death, 99% of the COVID-related deaths have one or more of the comorbidities or risk factors. We don't often speak about those who don't have. We have had 5 persons who had none of these risk factors for death, and 3 males, 2 females, as young as 36 and up to 54 years. So it may not be common, but the risk is still there. It might be small, but the risk is still there. So we all have to be careful.
Within the last week, we have been seeing a sharp increase in new COVID-19 infections. But what is driving these numbers? Dr. Webster-Carr spoke to this.
So what is fueling the increase? The non-adherence to protocol in all settings. Why do I say that? For example, the increase in workplace clusters. We see that restriction work in decreasing the infection rates. Other factor, interaction among teens and young adults. The highest burden of the disease is among the young adults. And we note that increase and decrease in schools opening and closing is shown. The UK variant would increase the risk of transmission based on what the literature is saying, and there is an increased risk of reinfection.
Opposition spokesperson on finance, Julian Robinson, says the government's budgetary allocations are insufficient to tackle the deepening economic and social fallout caused by the COVID-19 pandemic. He voiced his arguments in his submission to the 2021-2022 budget debates in Gordon House this week. Mr. Robinson says the prices of basic foods have increased since 2016. He points to a recent United Nations International Children's Emergency Fund and Caribbean Policy Research Institute study showing that Jamaicans have had to cut back on food, especially during this COVID-19 pandemic.
The cost of saltfish, cooking oil, chicken back, and rice, as examples, have increased by over 100%. And Madam Speaker, I want to show you what we mean by the food insecurity. Prime Minister never bring the basket. Never bring the basket. But I want to show you the price increases. Chicken back, $60 in 2016 is now $140, an increase of 133%. Cooking oil, $85 in 2016 is now $220, an increase of 158%. Tin mackerel has moved from $55 to $100, an increase of 81%. Rice has gone up from $31 per pound to $62 per pound, an increase of 100%. And sugar has gone up from $55 per pound to $121, an increase of 120%.
He notes the government's move to allocate funds to support the most vulnerable and says what is being proposed is inadequate.
People matter, Madam Speaker, and good policy must have people's interests at the heart of it.
The opposition spokesman speaks of the strain on the health system due to the COVID-19 pandemic and addresses the plight of healthcare workers.
The daily reports of COVID cases, coupled with the stories of our brothers and sisters being turned away or passing away in hospital that are under-resourced, are heartbreaking and increase anxiety. Our healthcare workers are giving their all, but they need support. Our hospitals need more resources. This situation was not caused by COVID. However, Madam Speaker, since COVID, the reality is that health poverty and health insecurity in Jamaica have worsened. I want to use this opportunity on behalf of the opposition to thank our doctors, our nurses, and all the healthcare professionals on the front line who continue to go beyond the call of duty to serve the public. And when we speak about healthcare professionals, we immediately think of the doctors and the nurses. But I also want to recognize the unsung heroes. They are the orderlies, the janitors, the lab techs, the pharmacists, all of these professionals who make up this ecosystem.
Mr. Robinson says the country will see the effect of the COVID-19 pandemic for years to come, particularly in the education of our next generation.
The effects of the pandemic will last for a long time to come, given the number of children who are unable to access online education. And particularly in the rural areas, the percentages of students who can't access are extremely high, sometimes up to 80%. This issue must become a priority. If not, poverty will become even more chronic.
The debate resumes next Tuesday at Gordon House with opposition leader Mark Golding. Students in grades 10 and 11 who wish to defer their sitting of their CXE, that's the Caribbean Examination Council exams this year, are required to indicate their intent for deferral by May 1, 2021. Minister of Education, Youth and Information, Favour Williams, told viewers of this week's virtual post-cabinet press brief that the ministry has prepared guidelines for those students who would like to do so.
These guidelines are to ensure that we manage the process efficiently, effectively, and judiciously. In addition to the ministry bulletins that will be sent to our principals, we will arrange a virtual meeting with our principals as well to detail the process for application for deferral, the considerations or criteria for approval to defer, and we will also detail for our schools how we treat with the retained or deferred students. Taking into consideration the loss of learning many students would have experienced, CXC will share with the Ministries of Education for communication to candidates the broad topics to be assessed on paper 2. This will be done 5 weeks in advance of the start of the exam.
The CXC administered Caribbean Advanced Proficiency Exam CAPE, Caribbean Secondary Education Certificate CSEC, and Caribbean Certificate of Secondary Level Competence written exams will commence on June 14 and end on July 16, 2021. Cabinet has approved an agreement with the Pan-American Health Organization, PAHO, for Jamaica to receive technical assistance from their team. The move will aid in strengthening Jamaica's health systems and services. Information Minister Favour Williams gave the details at the recent post-cabinet press brief.
The coordination between primary and hospital care and the organizational arrangements of the regional health authorities needed to be simplified and reoriented towards health outcomes instead of financial and administrative outputs.
Minister Williams says Cabinet has also approved the disbursement of $800,000 as a voluntary contribution to PAHO.
PAHO will provide technical assistance in the development of the primary health care policy and strategic plan and the development of an implementation plan for strengthening the steering role of the Ministry of Health and Wellness. The assistance will also streamline the functions of the regional health authorities, conduct a needs assessment for health technologies, and the development of a health technology assessment framework in the public health sector, the development of the human resources of health gap analysis, strategic 5-year policy, action plan for human resources of health, and the review of the National Public Health Laboratories will also be a part of the technical assistance.
The International Development Bank, the IDB, has thrown $75 million lifeline to Jamaica. We get those details plus much more in today's extended edition of the Business Report with Gabriel Thompson.
Jamaica is to receive a $75 million loan from the Inter-American Development Bank IDB. In a release issued on Thursday, the IDB said the loan is to strengthen the efficiency and effectiveness of public policy and fiscal management in response to the health and economic crisis caused by the ongoing coronavirus pandemic. It is the first of 2 policy-based loans and is intended to promote the availability and timely execution of public resources to respond to the health crisis caused by COVID-19. Jamaica, like other Caribbean countries, has been hit hard by the pandemic, as nearly a third of the island's output and employment are linked to the tourism sector. The IDB loan is to assist with financing cash transfers to employees, grants to low-income formal workers, vulnerable groups, and the unemployed, and provides student loan relief. It will support small business grant programs, especially in the tourism sector. The income tax deadline has been extended to Wednesday, March 31. Companies, partnerships, self-employed persons, and employed persons with other sources of income have until March 31 to file their income tax returns for the 2020 filing period and estimated returns for 2021 without any charges being applied. In a release issued Thursday, the Tax Administration Jamaica TAJ urged all filers to make their payments by the usual March 15 or prior to the end of the fiscal year. The tax authority says it has taken the decision to extend the income tax filing deadline from March 15 after careful deliberations in light of the impact of the COVID-19 pandemic on businesses as well as a recent system downtime. Corporate bodies are reminded that due to the delayed introduction of the revised tax return form IT02 to be filed by companies, the completion of the new Schedule 1A, details of assets, liabilities, and shareholders' funds section featured on the form is not compulsory for year of assessment 2020. The revised form also now captures the $375,000 corporate tax credit, also referred to as the MSME tax credit, introduced for financial year 2020. In Thursday's trading session, the JSE combined index advanced by 4,038 points to close at under 400,000 units. Overall, market activity resulted from trading in 101 stocks, of which 46 advanced, 32 declined, and 23 traded firm. The junior market index advanced by 46 points to close at under 3,000 units. Stocks advanced for 1834 Investments Limited, Access Financial Services Limited, and Blue Power Group Limited. Stocks declined for 138 Student Living Jamaica, AMG Packaging and Paper Company, and Barita Investments Limited. Trading firm were Caribbean Flavors and Fragrances Limited, First Rock Capital Holdings USD, and General Accident Insurance Company Limited. Trans-Jamaican Highway Limited was the volume leader with 4.3 million units, followed by Wigton Wind Farm Limited ordinary shares with 4.1 million units, and Lasco Manufacturing Limited with over 2 million units. In foreign exchange trading for Thursday, March 11, the US dollar ended trading at $147.64. The Canadian dollar sold for an average $118.40. The pound sterling traded for $204.97, and the euro ended trading at $178.21. Oil prices rose more than 2% on Thursday on a weaker dollar and expectations that a crude glut would be short-lived due to a steep fall in U.S. fuel stocks and a resumption of operations by Texas refiners. Brent crude oil futures for May settled up $1.73 to $69.63 a barrel. West Texas Intermediate crude futures for April gained $1.58 to $66.02 a barrel. And on that note, we end this Friday edition of the Business Report on PBCJ. I'm Gabrielle Thompson.
In regional news, we begin in Guyana, where the Ministry of Health on Wednesday rolled out its countrywide COVID-19 vaccination program at 13 health centers across the country, stressing that the vaccine is safe and will reduce the chance of becoming severely ill or hospitalized if one were to contract the virus. The ministry said the current target group is persons 60 years and older. Danica Paul from Newsroom Guyana visited one of the vaccination sites and filed this report.
The elderly residents of Enmore visited the Enmore's Polyclinic this morning very early, where a batch of the COVID-19 vaccines were made available to them. Sharing with the newsroom, these residents stated that they were very appreciative and excited of this effort given to them by the Ministry of Health.
Today we're doing vaccination for the COVID-19 vaccine, basically for the person 60 and older and persons with chronic disease, also healthcare workers. Today we're administering two types of vaccines, which is the AstraZeneca Covishield vaccine and the Sinopharm vaccine. The process is not a very long process where the persons are required to walk with an identification card. They're being checked, screened by other colleagues, and they're given their card and returned it, and they're given their vaccine.
That was registered nurse Denise Semple, who also encouraged elderly persons not only from Enmore, but other areas where the vaccines are administered to be responsible and get vaccinated.
I would like to encourage persons, especially the elderly, to come and have their vaccination done because elderly persons are one of the most vulnerable persons for COVID-19. In order for us to eliminate COVID-19 in Guyana and in the world, persons need to be vaccinated and take their vaccination seriously.
Speaking with the newsroom, elders who received their first dose of the COVID-19 vaccine today shared their experiences and offered words of encouragement to those who are contemplating taking the jab.
My name is Mahmoud Shah, 74 years of age. I'm happy to have the vaccine now, and it's necessary for everyone to take it to avoid COVID-19.
I would advise people to take the vaccine. You know, at least it kind of, it won't, as they say, won't prevent you from getting it, but it will at least, you know, keep you kind of safe.
So how do you feel after being vaccinated?
Well, no adverse feelings or anything, just normal.
My name is Miss Corey Williams, all the way from Little Diamond. I was so excited when I heard about the vaccine, and I advising people out there, elderly people, to come and take the vaccine. You put trust in God, not the rumors that you're hearing. I am so grateful to get this vaccine. I'm so far feeling well where the vaccine is concerned. So just to the public, come and take the vaccine. Stop listening to rumors.
The Edmore Polyclinic is one of the 13 locations the ministry has made vaccine available as of Wednesday, March 10th. Additional locations will be announced shortly as the ministry continues to roll out the vaccination program. These locations are expected to work from 8 a.m. to 4 p.m. Persons 60 years and over are advised to visit health centers or immunization centers in their area and present their national identification card before being administered the vaccine. Reporting from Edmore's Polyclinic, for the newsroom, I am Danica Paul.
Over in Barbados, Prime Minister Mottley is promising that vulnerable populations in the society will be protected under the 2021-2022 budget. The estimates are to be reviewed on Monday, March 15. We get more in this Barbados Today report.
Barbadians can expect heavy focus to be placed on protecting the vulnerable in society when the 2021-2022 estimates of revenue and expenditure are revealed on Monday. Prime Minister Mottley gave the assurance last evening during an address to the nation. She hinted that significant resources would be set aside to ensure those persons were protected during the COVID-19 pandemic.
The approach taken by the government with the estimates was driven by, one, our desire to continue to protect the vulnerable and those who are not capable of supporting themselves. And for the first time since independence, those numbers expanded in a way that we would never have anticipated at any point since independence. We are still there for you through the different provisions in the estimates, in large measure.
In giving a sneak peek of the estimates, the Prime Minister revealed that government would continue to focus its finances on capital works projects and on digitization.
Secondly, that we recognize that with the implosion of the private economy, that government is the only entity in the country with sufficient girth to help keep activity going at a pace such that we can keep people earning and people being able to have access to jobs. And that is why a lot of the activity is capital works, one-off activity, as opposed to recurring spending. That was the mistake we made in 2008 and 9 when we put our emphasis on jobs that was just simply recurring spending rather than treating to the issue of getting projects done, whether the projects are housing or roads or repairs or whatever it is, or the one-off expenditure which we are carrying because of COVID, that has increased significantly the amount of money that the Ministry of Health and the government has had to spend. And the third area, of course, relates to continuing to remove the obstacles and continuing to do those things that will enhance our competitiveness. In this year, we expect to be able to complete the digital ID project. We also expect to be able to complete a number of other areas of activity that will allow for far greater digitization within the economy. And to that extent, my friends, I expect that business will continue to become easier to be conducted in this country.
In sports, Vaccinate or athletes. That's the plea from former president of the Jamaica Athletics Administrative Association, the JAAA, Dr. Warren Blake. He's advocating for track and field athletes to be given the COVID-19 vaccine as they prepare for the upcoming international competitions, including the Tokyo Olympics in July. Dr. Blake, who stepped down last year as JAAA president for 9 years, he says he is not asking for any athlete to be given special treatment, but says some consideration should be given to those who will be going to the Olympics. He was among the first batch of Jamaicans inoculated on Wednesday. Several months ago, the International Olympic Committee President Thomas Bach said athletes taking part in the Olympics would not be obligated to take the vaccine. The Tokyo Olympics was postponed last year owing to the global pandemic. And that's the news on PBCJ. Thanks so much for watching.